Good afternoon, everyone. My name is Rachel Volpe from the New England QIN-QIO, and I will be your moderator for today's webinar, QPP Portal, Preparing for 2018 Data Submission. This webinar is presented in collaboration with the New England Rural Health Association. Before we get started, just a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of the webinar. The phone lines, as I have mentioned, will be on mute for the duration of the presentation. And if you haven't downloaded the slides, I have put a link in the chat where you can find the presentation. We will take questions at the end of the presentation, and I will provide you instructions on how you can ask the question over the phone. Throughout the presentation, if you have a question, you can enter it into the chat box at the bottom right-hand of the corner of your screen. Please make sure to send all questions to all participants. I will now pass this over to Leila and Chris to get us started.
Great. Thank you, Rachel. Hello, everyone. My name is Leila Blinsky. I am pleased to be joined by my colleague, Chris Hopwood. We are both Senior Program Administrators at the New England Quality Innovation Network Quality Improvement Organization. And today we get to tell you all about the QPP Portal and how to prepare for your 2018 performance data submission. As Rachel mentioned, if you have any questions as we go through the presentation, please feel free to enter them into the chat. This might be all new content for some of you. It might be familiar content, but we want to make sure that we're getting your questions answered as timely as possible because the data submission window obviously is about halfway over now, so it's really important to make sure you have all of your questions answered. So we will get started. Just quickly, we'll go over the HARP account, which is a new account. I'll tell you a little more about that in just a moment, why you need a HARP account, how you can register and create a new account. We'll go through the QPP Portal data submission, talking about eligibility, the performance categories, and then we'll leave lots of time at the end for questions and discussion, as well as share some additional resources with you. I'm going to hand it over to Chris.
Good afternoon, everyone. Thank you, Leila. So when we're thinking about navigating the quality payment program, we think about it in cycles. And, first thing is we have to determine if we're eligible for the program. If we determine we are, we then select our measures and activities, we collect that data, and then we report out our data. But I wanted to, we're talking mainly because we're in our submission period for 2018, and so a lot about the HARP account is we need to report out our data. But there's some other things that we can do that are beneficial on the HARP account. So besides, submitting our measures and activities for quality, promoting interoperability, and our improvement activities, you can also submit quality measures through the CMS web interface for the Shared Saving Program or NextGen. You can submit your HCQIS in the QRDA format for CPP Plus, which is the Comprehensive Primary Care Plus program. You can use the HARP account to view performance feedback and payment adjustment information. And the feedback usually is from CMS. Those reports are usually coming around in July. You can request a targeted review if that's something that you need. You can also, if you're doing claims-based reporting, you can see the in-progress performance. You can also view eligibility for all the clinicians in your practice or in your virtual group. And you can register for things like the CMS web interface or CAPS for MIPS. Also, the HARP account will give you access to view, physician compare, the preview for your particular practice, and it will allow you to grant others access to your organization if you're a security official. So really, when we think about, for the purposes of today's webinar, getting our data and reporting that out, if you don't already have an EIDM account, you'll need to register for the HARP account, and Leila will do a phenomenal job of walking you through that process. The second part of that is connecting to an organization, and you really, you'll need to do that in order to, manage, submit the data on behalf of your organization. And then the security officials will need to approve or deny requests. Leela's going to go through, if you don't have a security official, how you set that up. But that is important because as of December, you'll need the HARP account to approve requests from other users or submit or manage data on behalf of the organizations you represent. So I'm handing it back to you, Leela.
Great, thanks, Chris. So we have a couple slides before we get into all of that excellent detail that Chris has provided on the HARP account. The first is, as I mentioned, we're right in the middle of the data submission period if you're submitting your data through the QPP portal or through a registry or other third-party vendor. If you will be submitting your data using the CMS web interface, so that's for all of the ACO or alternative payment model participants, as well as any of those large groups of 25 or more eligible clinicians that registered with CMS back in 2018 to use the portal in 2019, you have between January 22nd and March 22nd to submit your data to CMS through the web interface. So now into HARP. So HARP stands for the HCQIS Access Roles and Profiles account. As Chris mentioned, this is a new account type that CMS will be using to grant you access to the QPP portal for all of those different elements that she mentioned. So getting access to your previous feedback reports, submitting your data, identifying if you have eligible clinicians, and really just gaining access to all of those little bits of data that you need in order to be successful in the quality payment program, regardless of which track you choose, whether you're under the alternative payment model track or the merit-based incentive payment system or MIPS track. As Chris mentioned, previously HARP was, or there was a whole separate system known as EIDM, that's the Enterprise Identity Data Management System. That's how you would log into the QPP portal. If you already have an active EIDM account, you can still use all of your same login information. Going through the qpp.cms.gov website, you would just go ahead and log in, and all of your data should still be in the system carried over into this new HARP account. Kind of quick change of names. If you don't have an EIDM account, you definitely want to make sure that you register. So if you currently have an EIDM account, you would go ahead and go to the website. If you don't, then you need to set one up. We'll go through all the steps to setting one up now. So the first step to setting up an account is that you would go to the qpp.cms.gov website, and up in the top far right corner, you would see a sign-in box. That's the first one that you see highlighted in red, and I apologize, these screenshots are a little small. Once you click sign in, you come to this QPP webpage that you see currently. If you already have an account, you would just go ahead and enter your username and password and log in. If you don't have an account, you would want to click the second button, which is all green, and it says register. Once you click register, you get the opportunity to register. You can also click, if you don't want to click the green tab at the top, next to the login, there's another highlighted box that allows you to register for a new account. So lots of different pathways, as you can see, to get to the same area to create an account. Once you click register, you come to another screen which kind of just talks about what the HARP account is, why you need one, and you'd want to go ahead and click register, that orange button at the bottom. Next, you're actually in the HARP account system, and this is where you would select all of your profile information. So you would enter your first name, last name, address, date of birth, social. It's really important here to remember that the address is not your business address. It is your personal home address. CMS, as I'll talk about in just a moment, goes through an identity verification process, and that all goes back to you personally, not to your organization. So just keep that in mind as you enter your data. Next, you would want to select a user ID, password, and challenge question. Again, always important to make sure that you have the appropriate level of security, but that you pick something that you'll be able to remember down the road. I know I have that problem as I have, a million, it seems like, different accounts. I can't remember which account password goes with which, so try to create something that seems synonymous with what you typically select or can easily remember. Next is the remote proofing. So this is very similar to the credit card credit confirmation that many credit card companies use. CMS has worked with Experian for this part. So you'll see it's very similar questions. Did you ever reside at this address? And it gives you a couple options. What company did you work for? And there's a couple of options. Different elements to confirm that you are who you say you are and that it is in fact your identity that you're matching to. If you've had any issues with maybe a stolen credit card or a breach on your personal data previously, either through maybe an online market source or healthcare organization or whomever, definitely there's another process which you didn't actually show here, but there is a link that if you have questions and need to go through this process a little more in depth, you can go through that with CMS directly. Be sure to go through that option because you'll have issues if there's any sort of holds on your personal data. We had issues with individuals last year where their identity had been stolen. They had notified their credit card company, but because there was this hold, they were not able to get at the time an EIDM account, which obviously put a big wrench in their data submission plans because this individual had been the individual identified by the organization to do the submission. So just make sure you work through the process as early as possible so that you don't run into issues with that April 2nd deadline. So we talked about this a little already, but just as a reminder, the reason why you need the HARP account is because it is now what was known as an EIDM account. It's the way that you access the QPP portal, and it allows clinicians to get access to their data. So we'll talk about the different roles, but it's really important to have this account. Oops, sorry, that got moved around. So this is what the screen looks like once you finish your remote proofing. You would get the login complete. It does take a little bit of time to get the full process completed, but once you have entered the data appropriately, you would get a confirmation at the very end. Next, you can log in and select your organization. Again, CMS is going with a two-factor authentication, so you'll have to make sure you select the appropriate way to get that additional code. Usually it's through a cell phone or email address. They'll send you that identification code. And here's where you select the device. Enter your phone number if you want to use your cell phone number, and then they'll send you the code, and you enter that code. Now, assuming the whole process has been done correctly, you would be able to access the QPP portal using that username and password that you've set up. If there's any sort of issue with your remote proofing, as I mentioned, if perhaps you had an issue with your data breach, whatever the case might be, you can contact Experian Verification Support Services directly, and then you'd want to go through the manual proofing process where they'll actually help you get through that process directly, verify your identity, and then help you gain access. So once you have access to the portal, this is where you would go in and select the organization that you want to be connected to. This is the critical piece that actually says, okay, let's say myself, Sylvia Linsky, has access to what organization? Where do I work? Whose data should I be able to see? Whose data maybe am I submitting in terms of performance criteria? Really crucial that you get this step identified. So if you were already able to get into the portal and already connected to an organization, this would be your landing page. You would see this Manage Access button on the side, and you would come in and see whatever organizations you're connected to. Just a quick overview of what that looks like. Next, you would want to come in if you don't have any organizations that you're connected to, or perhaps you need to add additional organizations if you're covering several different practices. You would come in and you'd say Connect to an organization. You have an option of 4 different choices. The first is a practice. Obviously, that would be one practice, usually identified by a TIN or tax ID number. There's also APM entity. Obviously, this would be if you are perhaps an APM administrator or an individual handling the data submission for that APM. There is a registry, which would be if you are a third-party registry member, gaining access to one of your practice's data so that you can submit on their behalf. And then there's also a virtual group option. So if you are an administrator handling the virtual group, you would want to make sure you select that so that you can submit all of the data for your applicable group members. You can only choose one option, so that's helpful. Make sure that you select whatever is applicable to your practice or organization. Next, you have to actually come in and find that organization. So you can use the legal business name or the TIN if you have that handy, and then the organization will pop up I don't show that screen, but it does do a matching where you can say, okay, it is Main Street Healthcare, whatever the name is. You select the appropriate practice. Then you would come in and you need to actually select your appropriate role. As Chris was mentioning in the very beginning of the presentation, there's a really critical role to have, which is the security official. The security official, pretty much by the name, is the individual that oversees the data submission, oversees the approval or denial of any additional roles or users within the account. If you were the very first person to try to get access to that organization or TIN or APM entity, you would have to be a security official, because as you're the first person, maybe there's additional clinicians or practice managers or whoever that need to gain access. You actually get to say yes or no whether or not they can have access down the road. So if you're the first person, you actually don't get an option to check the app user. You have to be the security official, but it does have a little information in this box as to what each role grants you. Once you move on, excuse me, in this case you would see that security official has been selected. You do have to do some additional data entry to make sure that you in fact know enough about this organization to be granted the security official role. So you would enter the practice TIN, an NPI of one of the connected clinicians, and then the PTAN number of that organization. And again, it's critical to make sure that you have all of those numbers entered correctly. Any error in documentation would make this potentially a more laborious process and limit your access if perhaps it was entered incorrectly. The process goes on. I don't have screenshots for the rest of it. Once you gain access as the security official, if you have additional staff users that you are trying to bring in, once you go into that manage access screen, if you had individuals trying to get a staff user role or additional security officials, if you wanted someone else to help you with the process, you would see this approve or deny, and you can go in and see what they were asking for. You can either approve or deny it. That individual will receive a message back saying whether or not their requests have been approved or denied, and you can go on from there. This is a nice little table to show you what, if you select practice, APM entity, registry, or virtual group, what each of the different roles will get you. So if you select staff user, what you can do, really, you see all of the data, and you can submit data with a security official. You can see all of the data, you can submit the data, plus, again, that you approve and deny additional user roles. That's really the main difference there. You will have access to all of these slides. You can come back and review this if you need to. Now on to the portal itself. So once you have your HARP account and you are able to get into the portal, this would be what we're calling kind of your landing screen. So you would come in and it would say, welcome back. Sorry, there's so many other black boxes hiding information. You'd come in, you would see your name. You could see the timeline for data submission. I apologize, this is an older slide, so the timeline shifted just a little. It's not March 31st deadline, it's April 2nd. You could also see that the performance window is now open for data submission. If you are ready to go, you know everything's in just right, and you want to go ahead and start reporting, you can jump right into start reporting to select your practice that you're going to be submitting data on and the performance categories that you want to submit as well. There's also all of the buttons on the left-hand side of the screen. You can review the eligibility and reporting options. You can review your performance feedback. You can go and check the physician compare preview. You can manage your access, or you can ask for help and get some information on FAQs. You can also access your final 2017 performance if you submit it through the portal at the bottom. So lots of different pathways to access the data depending on what you want to do and where you want to go. I'm going to hand it over to Chris.
Sure. So Leela did a great job about talking about managing our access. I just wanted to point out a few other things that, you know, it will tell you your particular role, whether you're the security official role, it'll actually tell you your role. It'll also tell you what types of the different platforms that you have access to. And it'll also tell you all the users that are connected to your profile and the different clinicians. So you can click in there and find out who your users are, and then any pending requests that you have as a security official. And one question that we have been getting is, you have a security official. If you're requesting access to the system, will you be told who that is? And CMS said that you will. If you have a pending role request, you'll be given the name of your organization's security official. So what sometimes happens is the security official leaves, and in that case, you would need to contact the CMS help desk to get help with that in that particular instance. Next slide.
Great, thanks, Chris. So the next couple slides go over eligibility and reporting. As Chris mentioned, you'll see all the details on where your practice is. So this is an example. This is for a practice. As you can see, there's 4 tabs along the top depending on what you have registered for. So there's APM, STs, registries, virtual groups, and practices. If you're affiliated with multiple practices, so in this example you can see this individual has 11 practices that they can gain access to. You would see the practice name, the TIN and address. You would also see a designation if they are perhaps a virtual group, which this one is. Talks a little more about what a virtual group is and if you want to read more about that. If you are ready to go ahead and start reporting for that group as a group or perhaps as individuals within the group, you can go ahead and click one of those buttons. And if you want to see specific clinician eligibility, so maybe you have 10, 20, however many clinicians within the practice, you can go ahead and click on that View Clinician Eligibility, and it will actually show you within that practice all of those clinicians that are eligible. So very helpful. Hand it back over to Chris to talk about some more of the details.
So one of the things I wanted to point out for some of the smaller rural practices, when you're looking at the detail of the eligibility, if you click under each clinician, it will tell you if they exceed the low volume threshold, the total number of patients, Medicare patients, the allowable charges, and it will also say any specialty statuses. In this particular case, this clinician was in a HCQIS area and was also considered a small practice. So that information will be in the eligibility section in the detail under each clinician. Go ahead, Leela.
Great, thanks. So next, you can also see just some more screenshots in case you have questions about the practices. So this specific practice, much like what Chris just showed you with the clinician, it shows you that this practice exceeds the low volume threshold, their total Medicare patients, and their total allowable charges. This practice also had a couple special status designations, so ambulatory surgical center, as well as a HIPSA area and rural. So they had quite a few attached to their practice. You can also see registries, so if you're planning to participate with a registry, you would be able to come in and see registries that you have registered with. So this practice is registered with IRIS, as well as the AAD's Data Derm. Again, if you want to submit data, perhaps you got a report from your registry, you could come in and report that data out. You'll also see information if a practice is MIPS exempt, which is nice. So let's say you have a handful of practices that you're submitting data on, and you come to one that says MIPS exempt. You would actually not need to submit data for them if they're all exempt, and it would show you that they don't meet the low volume threshold, and this looks like for the total clinicians, they were under the requirements. You can see all of the different information. This is actually nice as well here. You can see CMS gives you quite a bit of data right in this one screen. This practice also was participating in the Improvement Activity Study, which means that they would get credit for participating in that under the Improvement Activity performance category. Again, if they were reporting data, if they're MIPS exempt, then they wouldn't need to submit data unless they wanted to voluntarily, but that's, again, up to their choosing. I just want to call out on the side, again, all of the different navigation options. So under the eligibility and reporting, you can see here we're under the practice details and clinicians. So that very top option. If you want to drill in more, you would go to the group reporting overview, and then you can also go into each of the performance categories. You can submit data for that group. So you could go right to quality measures, you could go right to promoting interoperability, or right to the improvement activity category, right from the sidebar. Or again, you can go back out, you can click report, and then you get the options for each of the performance categories. As we get into the reporting overview, you'll see now, as you click on group reporting overview, this is what it would look like if you're getting ready to start submitting data. So you see the practice, the TIN, the address. You could print out the screen if you wanted to. You can also go right to upload a file. So if you have a QRDA3, an XML, or a JSON file, you can go ahead and update that, upload it right to the portal. It's pre-coded, so the portal will automatically pull all of the different quality measures or improvement activities or promoting interoperability measures data right out of that report and put it into the performance categories for you. And I'll show you a little more what that will look like in just a moment. So if you're ready to start reporting, I apologize, the screen is very long, so we'll go through kind of piecemeal what it looks like as you move through the categories. So if you want to just start reporting, you can go ahead and upload a file. Next, you see your performance category, performance for quality. This group has actually had their category reweighted. So you get little tidbits. As I said, CMS puts in lots of information throughout the portal for you. So as you can see at the bottom of this quality screen, it says quality counts for 75% of your score. So right there, you know immediately that this group, we're going to assume, has received a promoting interoperability hardship or had the performance category automatically reweighted based on the clinician types that are in it. And so now all of a sudden those 25% points from promoting interoperability have been shifted over to quality. So now quality is 75% of their score. So however they participate in quality, they want to make sure that their score is very high so they can get the majority of their points there. If you're ready to submit quality data, you can go ahead and click Start Reporting. I'm going to hand it over to Chris.
So the only thing just wanted to highlight with this is that you do have multiple options when you're doing quality. You can certainly upload your QRDA3 file or your JSON file, as Leela mentioned, and also you can use a third-party agency and give them permission to do the upload. So you have, besides that and doing claims, you have different options within the portal, and the portal actually will walk you through which option do you want. Do you want option 1? Do you want option 2? Do you want to report as a group? Do you want to report as an individual? Next slide, please, Lisa.
Great, thanks, Chris. And you actually brought up a good point that I realized as you mentioned claims that we don't have any screenshots of. If you chose to report your quality data through a CMS Medicare Part B claim, there is data pulled right from your claims where you can see your performance. But I don't know, Chris, have you heard whether that's up and active yet or if they have to wait until 60 days into the year to get that final claims process finalized?
We do see, you can see the active claims on the portal right now. For those that are reporting claims, you can see that.
Excellent, thank you. So as we move down the performance reporting overview, you see promoting interoperability. Again, this practice had their score reweighted, so you see PI counts for 0% of your score. And then you can also see the improvement activity category, and there's manually enter. You can see a score, lots of information on the page, and the total performance category weight. We'll just jump down one more. Go ahead, Chris.
Sure. So I just wanted to point out that if you're smaller, rural practice, you have a specialty status, you can see how it will tell you have the specialty status, so we're going to count your improvement weights twice the points. So these the portal, CMS has done a really nice job of letting you know, and if you know that you're in a small practice and you're not seeing this on your improvement activities and you're not seeing that you're getting calculated double points, that would be something that we would need to address with CMS. But so far, all of the submissions I've done, I have seen that they've been calculated correctly this year, so that's good news. Next slide.
Great. And as we get to the bottom of the page, you would see cost. Obviously, cost data is pulled right from your claims, so you don't actually have to submit anything to CMS. And then additionally, for any of the bonus points that are reported either for compensation bonus or if you participated in 2017 and got a quality improvement bonus, then you would see those bonus points register at the bottom of your screen there. Next, just a quick screenshot of if you decide to upload a data report, what it would look like. So you come in, you get the option to either do a drag and drop, or you can search your desktop or folder for the appropriate file. Again, it's really important to make sure you have that QRDA3, JSON, or XML file. Those are the only 3 file types that are allowed. So you would go in, select the appropriate file. As you can see in this example, the practice has selected all category _EHR.json. That's their file. If you did an upload and it was successful, you would see a green box show up that says upload successful. If you chose the incorrect file type or perhaps there was an error in the data or it was corrupted in some way, you would get, I believe, this little red X that would show you that the upload was not successful and you'd want to make sure to go back in and correct that file. We did hear last year, although I haven't heard anything this year, that there were some issues with data reports being created by some EHR vendors that had some inherent corruption that wasn't allowing them to be uploaded correctly, or that measures were not being scored appropriately. Definitely, if you do upload a file, go back and check all of your measures to make sure that the quality data looks appropriate. We'll talk a little more about how it all looks when you go to the specific performance category, but don't just assume if you upload it's all set to go. Be sure to go back and check. So now we'll dive into quality reporting. So as you can see here, this is what it would look like if you submit an EHR report. So this practice is getting the full performance points. They can't actually get 100 on quality performance, but they've gotten the max performance points available. And then if you were to dig in a little more on this performance category, you could see the measures specifically that they have reported on, the total performance category points that they were earning. You can go a little further and actually drill into each specific measure. Let's say you're looking at a measure and you're like, I wonder why I got 8 points. How was my performance? Where did I fall in terms of the established benchmark? So you can go in and look for the diabetes hemoglobin A1C measure. You can see, oh, okay, performance at 33.3, which earned me 8.1 points. In terms of the benchmark, because this was EHR reported, you fell right in the 7.11 benchmark. It does a nice job plotting the data. You can also see on the far right-hand side, there's details. It shows you your numerator, denominator, if you met data completeness requirements, if you had a population, what that population was, and then any sort of additional performance and bonus points you might have earned. Again, because this was through an EHR report, this practice earned 1 point for having end-to-end reporting, which means that they get their data right from the EHR and upload it. There's no manual abstraction or manipulation in there. If you had questions about what your actual measure specification was, there's a nice hyperlink. You can go right out to the specification and see, okay, what's the population for this measure? How does my population stack up? And evaluate it that way as well. If you're looking for your total performance category scoring, if you scroll all the way down to the bottom of the page, past all the measures you submit data on, you would see your total performance category score for all of the measures you submit, plus any bonus points that you earned, times or over your total possible score for the category times the category weight. So this practice has the 50%. It wasn't reweighted to 75. So they ended up earning the full 50 because they capped out at actually over 50%, but obviously you can't earn more than that. From here, because again, CMS is giving you lots of different ways to navigate around the website, you can go back to your overview. You can move on to Promoting Interoperability, or you can go over to that Eligibility and Recording sidebar and choose either a different performance category or a different part of the practice maybe you want to go look at. It's really up to you to navigate around how you see fit. Next, we'll dive into Promoting Interoperability. Unlike quality, which really only has, well, technically 3 ways of submitting data. As Chris mentioned, there's claims, there's third-party submission through a vendor, either EHR or registry, or you can upload a report from your EHR or your registry. For Promoting Interoperability, there are also 3 methods. Claims is not an option for Promoting Interoperability, it's only for quality. You can either submit your data via a report from your EHR or your registry that EHR or registry can submit on your behalf, or you can manually attest to data, which we'll talk about mostly because the report is a pretty simple process. You just add the report and then check your performance. The same 3 options are also available for improvement activities, which we'll talk about in just a moment. So as you can see here, this is an example of if you submit your data via the EHR, not a manual attestation, and how many points you have earned. This is another landing page for the performance category. Here you can see EHR, you got 100 out of 100 points, or if you did manual attestation, what that would look like. For a moment, we're going to just pretend that we did not submit data and that this is blank, and that we're going to go through the manual attestation process. So first you need to select the performance period that you're submitting data for. For Promoting Interoperability, this needs to be at least 90 days, and that's a continuous 90-day period through the year 2018. So it could be the first quarter, middle quarter, last quarter, any random 90 days, but it has to be a 90-day period at least somewhere between January 1st and December 31st of 2018. Once you select your reporting period, next you have to select the measure set that you'll be using. There are 3 options to choose from. Depending on the certification year of your electronic health record, then you would select which reporting option is the best for you. So under the 2018 Promoting Interoperability Transition Measures, these are really for the clinicians and practices that are using 2014 certified EHR technology. These measures are very similar to the Meaningful Use Stage 2 modified measures. If you are on a 2015 certified EHR, you have the option of selecting any of the 3 options, which are the 2018 Promoting Interoperability Transition Measures, the straight 2018 Promoting Interoperability Measures, or a combination of the 2 measure sets. Just as a side note, the Promoting Interoperability measures are very much in line with the Meaningful Use Stage 3 measure set, so if you're curious what the differences are there. If you have gone through an upgrade or any other transition throughout the 2018 performance year, you've kind of had both 2014, 2015, you are more than welcome to select that combination option. It's really what works best for your practice and selecting the measures. Once you select the measure set, so here we have at the very top, you can see the combination of both measure sets. So this practice is planning on using both transition and regular measure set. You would see your total score. It also tells you the number of measures you've reported on. This practice hasn't yet submitted anything. There are still the 3 attestation statements similar to 2017 if you submit data for QPP in 2017. These are required. You do have to provide an answer, although once it's optional, you do have to say yes or no. So you can go through. If you expand with a little arrow, you can get more information about what prevention of information blocking attestation means. These are all attestation statements, so you're expected to be truthful and honest in what you say. But again, they're just statements you need to either say yes or no to. Next, you go into the base measure required. We'll go through what those look like. So I'm only going to show you just a handful of measures. The first is e-prescribing. So under the combination option, you have the choice of selecting either the transition measure or the plain measure. For e-prescribing, there really isn't a difference. You would, if you're manually attesting, go ahead and enter your numerator or denominator. If you have fewer than 100 permissible e-prescriptions, you can take an exclusion for this measure. And at the bottom, you can see proposed measure exclusion. You want to make sure you go ahead and click that box. That would gray out the measure for you and not require you to report data, but you would still meet the requirements for the base required measures. I won't go through the rest of the base measures, but I'll give you an idea of what the performance measures look like. It's all just about the same. Not all measures have exclusions. There's only actually 3 measures that have exclusions, and they are all within the base required measures. The other 2 have to do with health information exchange and sending that electronic summary of care. And again, it's all based on 100. So if you have fewer than 100 referrals or transitions during the reporting period, you could take that exclusion for either of those measures, again, depending on the measure set you select and the year of certification of your EHR. But as we carry on, you'll see for the performance measures, this is just the first measure selected, so patient-specific education. You would go ahead and enter your numerator denominator. It would give you a score based on your performance, and you could get also the measure specification if you were curious. Before we carry on, I just want to show you one more thing at the top of the screen. You'll see combination options. You'll see your total score. So this practice thus far has a 90 out of the possible 100 points, and the total number of measures that have been reported on. Just as a side note, 3 of those measures come from those attestation statements. Even though technically they're not a measure, you do get 3 in the total measures completed. As you move down, we'll also look at the bonus measures. I only have the 2015 CERT bonus showing and the improvement activity, but there is also the clinical data registry bonus if you have that you're taking. So this practice took the 2015 CERT bonus, so that's giving them 10 extra points. You can see they've capped out their 100 of 100 points possible. If you did end up using your certified EHR technology to support the implementation of one of the appropriate improvement activities, you can go ahead and take that as a bonus. Just as a reminder, that doesn't happen automatically. You do actually have to attest to using certified EHR technology in the implementation of an improvement activity to get that 10 bonus points. So just keep that in mind. Just like with quality, you can navigate back to your overview. You can go on to improvement activities, or you can navigate right back to those same categories or options on the left-hand side of your screen. Next, we'll go into improvement activities, and you can see here this improvement activity has already, practice has already reported 1 through their EHR, so they're getting 10 points out of the possible 40. You can get additional details here, or we can dive right into this performance category. You can't really see it, and I apologize, at the top of the screen. Very similar to promoting interoperability for improvement activities, you do have to select also a 90-day reporting period. It's a consecutive 90 days. Throughout the year of 2018, so you choose what works best for you. We've had a lot of questions about what happens if I select 4 improvement activities that all kick off at different points throughout the year, but we're continuously working on improvement activities. Then I would select the full calendar year because you're actively working on at least 1 improvement activity during the entire year. So just make sure you cover what your time frame looks like and that you're actually working on implementation or supporting those activities. Next, you would come down and actually want to select the activity that you're looking to report data on. There's lots of options. You can just scroll through if you want. You can also search by the different subcategories. So there's achieving health equity, care coordination, if you know where your improvement activity falls. You can also just search through the text box. For improvement activities, it's a pretty simple process. You literally check yes or no, and it's a little, not even yes or no, it's a little checkbox. If you go gray, if you're not selecting it, or green, as you can see at the bottom, if you do select it. The nice thing about the categories is it shows you the weight of that improvement activity and how many points you earn towards your final score. So currently, as you can see here, only 1 has been checked off, earning this practice 10 points. It's a medium weight, and they must be a large practice, as Chris mentioned with the different weighting for small and large practices. Small practices earn double points. Large practices earn the straight flat point scoring. So here with the 10 points, they get 10 of 40. 1 activity is then completed. Again, lots of information baked right into the portal. You can see above that this activity is eligible for the CERT bonus that I mentioned in terms of promoting interoperability. So if you check that leveraging a QCDR, you'd want to make sure you took that promoting interoperability bonus, and then come back. They won't actually link together, so just make sure you're getting those points if they're appropriate. I didn't show it on the previous screen, so I didn't have it previously, but if you look, so this practice has earned now the full 40 of 40 with 3 activities, and you can see at the very bottom right-hand part of your screen, a little green box pops up with a little trophy, and it says that you've maxed out the score and you've earned the highest possible score. So you get a little trophy to say you've done it, nice work, you have earned all the points you can for that category. And that will be true for all of the categories. You see that little pop-up, not just improvement activities. As I mentioned with the additional bonus points, once you go through all of your reporting, CMS will generate a score. You won't necessarily get all of your bonus points right here. It might take additional calculations on the back end that CMS will do when you get your final score, but you can get an idea of whether or not you are qualified for the complex patient bonus or, again, that quality improvement score. So this practice did get some of those bonus points. Hand it over to Chris.
So as we, begin to close out the webinar, just wanted to encourage you to, while you're in the portal submitting, take a look at your feedback summaries. They also have field test reports for your Medicaid, the Medicare spending per beneficiary and the total per capita cost. So as you're getting into your costs, these are great field reports and you have access to them. So while you're submitting your data, now through April 2nd, we just want to encourage you to take a look at that. And if you're not sure what you're looking at, reach out to Leela and I will make sure to put you in touch with the appropriate consultant, QPP consultant, to help you with that. Next slide.
Great, thanks, Chris. Yeah, it's really critical to know how you performed previously and if you have any questions on your data to make sure it all lines up. Just very briefly, if you are reporting through a registry, this is what a registry dashboard would look like. This practice actually has multiple clinicians within one report coming up. You could see what your performance looked like. So just a quick overview of what it would look like if you had submit via the registries. Chris, I'll hand it back over to you.
Sure. So we wanted to briefly just talk about audits. It's kind of the word we don't like to think about, but we do want to make you aware that you should be saving your quality reports with the clinician's names and time frames. Save those for 7 years. Also, save the documentation for your improvement activities, your security risk analysis. Also, as Leila was going through the portal, at the right-hand top, there are print this document. So I would print your total summary for all of your scores and the categories and save that submission receipt, as well as any screenshots from your EHR vendor. We have been given access to a templated document from our National Coordinating Center. If you're interested and you're thinking about preparing for your audits, we certainly reach out to Leila and I, and we can get you out those templated documents for your use. Leila,
excellent. Thanks. Perfect. Well, we are at the end of the presentation, so we'll open it up for questions. I see one question in the chat going back, way back to when we first started talking about the HARP accounts and the PTANs. And so the question is the PTAN an individual or a group PTAN? So great question. It would all depend really on that practice. So usually it will be the practice PTAN unless, of course, it's an individual clinician where it would be that specific clinician's PTAN. If you would like to ask questions over the phone, it's #6 to unmute your line, or you can go ahead and ask them in the chat. Oh, and before I forget, because I almost was about to forget it, Chris made me think of something when she referenced the audit documentation in the print screens. Much like last year, we had lots of questions about, well, how do I know that my data has been submitted to CMS? There's no submit button, there's no done button, there's no complete, end, finished, anything like that. Basically, your submission within the portal is a living document. So you can come and go anytime between January 2nd and April 2nd and update your data. You can change it, you can delete your reports, you can add them back in. It's living until that January 2nd at 8 p.m. deadline. If you have data in the portal, that is what CMS will score you on. So it's whatever you have present is what you're scored on, but you can come and go, you can add, move, change. Just make sure, like Chris mentioned, that you have supporting documentation to back up whatever data you're submitting. So have those reports, have the processes to support your improvement activities, security risk analysis documentation. Make sure you have all of that, but there isn't actually a submit button or a done, so just keep that in mind. I see a couple more questions. So if your certified EHR is upgraded after 2018, you can use it for your calculations. Are you allowed to attest for the upgrade? So I just want to make sure I understand the question. So you're saying that your certified EHR was upgraded in 2019, because if that's the case, you wouldn't be able to attest to having a 2015 certified system in 2018 because it hadn't been completed yet. And if I'm misunderstanding your question, please let me know. We use OfficeMate with reports. Do we use or do I need to call OfficeMate? I would definitely touch base with OfficeMate to make sure that they are submitting on your behalf. If they are going to submit data on your behalf, you would again want to make sure that they have access to the portal through either a staff user or security official, however you set up your practice, to make sure that they can submit their data for you. I see a question. If we had problems with our E, I'm not sure what that was supposed to be. Cheryl, if you could complete your question, I'm happy to answer it. Oh, sorry. Never mind. It was on the next line down. We have problems with our EIDM system. Can we re-register for HARP? We have heard of some practices going in and re-registering. You most certainly could if you had issues with EIDM. Really, the reason why EIDMs, if they were active and ready to go, was to save you the trouble of having to re-register. The whole process was supposed to grandfather in all of your data and pull it right over, so that it would save you a step. But if you've had issues kind of all along, I don't see an issue with that. Chris, do you have any thoughts on that?
I would contact the CMS help desk. If depending on what the issue is, I mean, if you have someone that has the security official role but they're no longer at your organization, you could certainly work that out with the CMS help desk. So kind of depending on what the issue is, but I would start there so that it does transfer right over.
Great, thanks for adding that in. We have a question here about small practices. Chris, would you like to take this one? I'll say the question, then you can respond to it. So it's for 2018. If our small group submitted quality via claims, should we submit improvement activities as individuals as well?
So if you submitted, that's a great question, and we've gotten that several times. The system does allow you to put in your improvement activity as a group, but I would not do that. I would, if you're submitting claims, obviously as individuals, then I would submit the improvement activities as individuals as well. I did speak to the help desk about that, and they thought that was a good idea because they were seeing some glitches around that. So that's a great question.
Great, thank you. That brings us to the end of the questions in chat. Again, feel free to ask your questions in chat or over the phone. It's #6. If you would like to send me an email, here's my contact information. I'll leave it up for just a moment, and then I'll jump to Chris's, and you can send her an email if you have questions for her as well. There's Chris's information. And I'm actually going to jump to one last slide. We have information on several different platforms and organizations. So we have our New England QIN-QIO MAPCA page, which has lots of updated information, toolkits, resources. We also have an Ask a Question link there if you would like to ask your questions there. Also links to the CMS Quality Payment Program website, which has just a ton of information on the program. You can look up your participation status. There's a great tool where you enter an NPI number, and that'll tell you if you're eligible or not. Also a link to the portal, and then also a link to our partners website, the New England Rural Health Association, to find out lots more information on their offerings and upcoming events as well. So question here, our EHR system is 2014-2015 certified. Which measure set should we select? So that's a great question. It really depends on what makes the most sense for your practice. We've often seen that practices kind of in that transitional period will go right with the 2018 transition measure set. Those are the measures that, as I mentioned, go back to meaningful use stage 2. So there's one less required measure. It's e-prescribing, security risk analysis, providing patients access to your portal, and then sending that electronic summary of care. For all of the numerator denominator measures, which are e-prescribing, providing patients access to the portal, and the electronic summary of care, you do have to have at least one patient in the numerator in order to meet the requirement. For the security risk analysis component, that's attestation only, so you just say yes or no, you completed the security risk analysis during the calendar year. And then you have to select as many or as few, either performance or bonus measures to get additional points. So just off the top of my head, I would say that's probably your best bet, but you actually have the option because you are using both certified years that you can go with either the 2018 transition set or the combination option set. You wouldn't want to go probably with the straight 2018 promoting interoperability measures because those really go more towards the 2015 technology offerings, and you might not have all of those available or completely integrated and ready to go. Sorry, that was a really long-winded answer. We have just a couple more minutes. Chris, is there anything else you'd like to add before we wrap up?
Sure. Just want to encourage you all to reach out. We provide no-cost technical assistance with the Quality Innovation Network, and we work with large practices, small practices, so make sure to reach out to Leela and I. We'll make sure to get you in touch with the right QPP consultant, and we're here to help you through this process, so we just encourage you to reach out.
Absolutely. We want to make sure everyone in New England and beyond does not get a payment penalty and hopefully gets at least some sort of positive payment adjustment, whatever that might look like under the program. We'll hang on the line just for 2 more minutes until the top of the hour, but if you have any questions, please don't hesitate. You can ask them again in the chat in the last 2 minutes. You can open up the phone lines at #6. Or if you would like to ask a question on our website, you can, or contact Chris or myself directly, and we are happy to help. No question is a dumb question, even if you feel like you've heard it before. We have lots of really specific, nuanced scenarios and different practices that we help organizations work through because really sometimes it comes down to subjective. How did you read the rule or the requirement? So make sure that you get your questions answered.
Hi, Leela. This is Rachel. On the last minute, just want to do a few last housekeeping items.
Sure, absolutely.
Reminder, Leela, if you wouldn't mind just going to the next slide, just want to remind everyone that we are on social media, to visit us on Facebook, LinkedIn, Twitter, and YouTube. And when you do close out of this webinar, the evaluation will automatically pop up on your computer. If you could please fill that out, we would greatly appreciate it. And if you don't have time to fill out the evaluation right now, or if you're currently sharing your computer with someone else, you'll receive an email tomorrow with a link to the evaluation, as well as a link to the event page on our website. The PowerPoint presentation is posted on the website, that is in the chat box. And within the next few business days, a recording and transcript of this webinar will also be added. And again, I have posted the link in the chat box. Thanks again for attending.
Thank you, Rachel. Have a great afternoon, everyone, and definitely reach out if you have questions. Take care.